Why insulin is not the answer most of the time for type 2 diabetes. Understanding the limitations of insulin therapy. Insulin is a crucial hormone that helps regulate blood sugar levels. It is often seen as the primary treatment for diabetes, a condition characterized by high blood sugar levels. However, there are several reasons why insulin isn't always the answer for diabetes management. In this image, I list the references I have used in creating this video. There is one reference that was related to present or former employees of Novo Nordisk AS who hold shares in the company. Novo Nordisk is a major manufacturer of insulin. I have not used that article to create this video, but you are welcome to read it. Insulin resistance is the term used to describe the situation where the body has enough insulin, but it is not doing its job as expected. Giving more insulin may make the situation worse. You can ask your doctor to do an insulin resistance test, which is a simple blood test. This is a condition where cells become less responsive to insulin's effects. There are lifestyle factors, medication and dietary habits to make insulin more effective. Oral drugs like metformin will improve the situation of insulin resistance. Also, some other oral drugs can increase the production of insulin by your own pancreas. There are newer oral drugs like SGLT2 inhibitors which let the extra sugar in blood go out with urine. All those oral medications or drugs are cheaper than insulin and easy to administer. Giving more insulin when insulin is already present, but cannot properly usher glucose into cells, will not be a good solution. Taking too much insulin, particularly long-acting types, can lead to persistent hyperinsulinemia. This is because the sustained presence of high insulin levels can desensitize cells to its effects, leading to insulin resistance and potentially worsening blood sugar control in the long run. Individual factors. Dosage. The risk of hyperinsulinemia from insulin injections increases with higher doses. It's crucial to work closely with your doctor to determine the correct dosage for your individual needs and adjust it as necessary. Type of diabetes. People with type 1 diabetes generally require insulin to survive, and hyperinsulinemia is less of a concern compared to the dangers of uncontrolled high blood sugar. However, for people with type 2 diabetes who may still produce some insulin, excessive insulin intake can pose a greater risk of hyperinsulinemia. Underlying conditions. Certain medical conditions like kidney disease or liver problems can affect how the body clears insulin, potentially increasing the risk of hyperinsulinemia with injections. Type of diabetes. The type of diabetes a person has can also influence whether or not insulin is the best treatment option. People with type 1 diabetes, for example, do not produce any insulin on their own, so they require insulin injections to survive. However, for people with type 2 diabetes, the body may still produce some insulin, and other lifestyle interventions, such as diet and exercise, may be sufficient to manage blood sugar levels. Side effects. Insulin therapy can also have side effects, such as weight gain, hypoglycemia, low blood sugar, and allergic reactions. These side effects can make it difficult for some people to adhere to insulin treatment, which can ultimately lead to uncontrolled blood sugar levels. Hypoglycemia can lead to death, as I have seen in my elder brother's case. There are new research to indicate even short-term hypo or hypoglycemia can cause brain damage. Weight gain. Weight gain is a common occurrence in insulin-taking people. That will most likely lead to more insulin resistance and fatty liver. Cost. Insulin can be expensive, especially in some countries. This can make it difficult for people with diabetes to afford the medication they need. Inaccurate dosing. Dosing insulin correctly can be challenging. If too much insulin is taken, it can lead to hypoglycemia. If not enough insulin is taken, blood sugar levels may remain high. Alternative treatments for diabetes. If insulin is not the right treatment for you, there are other options available. These include Lifestyle changes, diet, exercise, and weight loss can all help to improve blood sugar control. Oral medications. There are several different types of oral medications that can be used to treat diabetes. These medications work in different ways to lower blood sugar levels. Other injectable medications. In addition to insulin, there are other injectable medications that can be used to treat diabetes. These medications work in different ways to lower blood sugar levels. It is important to work with your doctor to determine the best treatment plan for you. There is no one-size-fits-all approach to diabetes management, and what works for one person may not work for another. I hope this information is helpful. Please let me know if you have any questions. Disclaimer: this information is not intended to be a substitute for medical advice. Please talk to your doctor about any questions or concerns you have about your diabetes treatment. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.